Really sorry if you can hear my father singing downstairs, but he won't answer his phone and he won't reply to any messages, and I can't be asked to walk. I thought you turned the music off, Eden. And I can't be asked to walk downstairs, so we're just going to ignore that. Chris can just feature as a background act. But welcome to my channel. Happy Sunday. Hope you've had a wonderful week, and I hope you enjoyed the last video. I had such positive comments and replies to it, so I'm very grateful for that. But for today, I thought I'd do not a more serious video. It's kind of like more of a serious topic, it's more of a serious topic, but I don't want to call it a serious video, if that makes sense. So what I'm going to be talking about in this video is quite raw. I don't think I'm going to show any raw images just because I'm not that open, okay? But if you don't like the thought of having things like put inside you or like injections or anything like that, then maybe don't watch this video. I talk about blood and all of that, so yeah, maybe don't watch this video if you're not a fan of that. Also, please take what I say, is it with a pinch of salt? I don't know. I'm not a doctor. I am very far from being qualified as a doctor, okay? I'm just talking on the basis of my own experiences, my friends' experiences, my family's experiences, and the people who have replied to something that I put out on Instagram, their experiences and their knowledge. So I'm not talking from a medical background at all. I'm just talking from experiences and advice that I can give from myself and from what I know about other people. So what I'm going to be talking about today is for all our ladies and any gents that want to be educated in this field, but it's all about women's contraception. Is that the only contraception? I guess a male contraception would be a condom, but women's contraception, the pill, the implant, the coil, the injection, the patch, all of that, all of those wonderful things that us women have to go through. Okay, that's just the tea, sis, that's just the tea. So recently I have had a change in contraception, mainly because the contraception that I was on was not doing anything for my skin or my mood or anything else, okay? Mainly because of my skin. So I went off that contraception and I was off it for about 2 months. And now I've been put onto a different contraception just because I am planning to go on Roaccutane in November, so in a few weeks. I don't know if that's going to still be happening. Like, I'll post another episode of my skin journey just because some things have changed, so stay tuned for that. But basically I've got this new contraception inside of me ready for that. So there are various types of contraception that you can get. You can get the combined pill, you can get the single hormone pill, you can get the implant, you can get the coil, you can get the patch, you can get the injection. There are multiple things. I'm sure there might be more, but they're the ones that I know just off my head now. Basically what each of them do, so we've got the combined pill, that is a mix of estrogen and progesterone, which is like, it's a combination of the two hormones. I'm pretty sure there's a little bit more involved in that, but that's just the black and white two hormones. We then have the single hormone pill, which in other words I'm pretty sure you can call the mini pill, and that is just a progesterone only pill, so just one single hormone. Next you have the implant. Again, I'm pretty sure this is one single hormone again. I'm pretty sure it's just progesterone. I can't actually remember if it is or not, but I'm pretty sure it is. And that is basically like a lollipop stick about this big, popped into your arm. And then we also have the coil, which again, you can either have a hormone coil, which is a progesterone only coil, or you can have the copper coil, and basically copper is toxic to sperm. So that's the contraceptive reason for that one. And you've got the patch, which again is a single hormone, I'm pretty sure, and then also the injection, which is single hormone again. So my contraceptive journey started off when I was 13. Yes, such a slag. No, I'm joking. I was put on, I've just kicked my tripod, there we are. I was put on contraception for my skin when I was 13 because I was suffering really bad with acne, and I'm pretty sure it was a hormonal imbalance. So I was put on the combined pill, I was put on Dianet, and that is a pill that you could only have for a year. So I was on that pill for a year, was the combined pill. So basically with the combined pill you take it for 3 weeks and then you have a break for a week, then 3 weeks, then a break for a week. So it basically regulated your periods as well. And yeah, that's the combined pill. You can also back to back the pills. So you can take it, you don't have to have a break for a week, you can take it for 3 months straight and then have a break. It's not really recommended just because that's like having 3 periods in one, so that's not really great for your body. And it is quite good to give your body a break like every month from taking this pill that stops you having kids. Like, how mad is contraception? I'm sorry. It stops you from conceiving. Like, the female body is mad, and this tiny little thing, or this thing placed in your womb or placed in your arm or injected into your bum, stops you having kids. How mad is that? So anyway, Dianet, I was on that for a year, and yeah, I don't think it actually majorly changed my skin that much, but yeah, I was on that for a year. And then once the year was up of taking that, I was put on various combined pills again. I then had to move on to the single hormone pill, which is the progesterone only pill. Again, the same thing, it's oral, it's in a pill, like a very, very small pill. However, the difference is you continuously take this, you have no breaks, and it basically will stop your periods. And that is why I needed that pill. So my body, my periods were fucking intense. Okay, they were not fun. They were not fun. I was physically throwing up. I was in agony. They weren't heavy, but they were so painful. Like, at school, I would always be in the medical room. It was horrible. My periods were not nice. So that's why I got put on the progesterone only pill to basically stop my periods, because my body couldn't hack it. You also are not allowed on the combined pill if you suffer from migraines, which I do, and if you have a history of breast cancer in your immediate family. I'm pretty sure it is. I've got it not in my immediate, so not in my household, but in like my aunties, uncles, like they're kind of not distant family, but like family outside of your immediate household family. So my family does suffer with breast cancer. It is in my family outside of my household, so that's another reason why I got taken off of it. I think the reason, like the main reason, if it's your immediate family in your household, but nonetheless I still got taken off of it because of the migraines. But ultimately it was to stop my periods because they were so freaking painful and I couldn't hack them. So I was on the single hormone pill, which in other words you can call the mini pill, and I was on that for ages. So I was on that for, I want to say a few years. Yeah, it would have been a few years, like quite a few years. And when I got to university, I just thought I might as well try the implant because it's the exact same thing as the mini pill, but you don't have to orally take it. It's put in your arm and it just releases the hormone without you having to set an alarm on your phone to take the pill. Like, you don't have to forget the pill. If you forget a pill, then you can't have sex for like a few days because it's not in your system. It's very confusing if you mess up not having a pill, so you might as well get the implant because then it's in your body the whole time. Haha. That is what I thought. The implant bruised the fuck out of me, okay? It cringes me out how this lollipop stick was in my arm. I've still got a scar from it actually, but it cringes me out how it was in my arm. Didn't hurt or anything, like they put the like a local anesthetic and then like slit you and but it didn't hurt at all. Like, it's just the thought of it that cringes me out. But I had that for 3 months and I bled the whole time. Okay, didn't stop my periods at all. I bled the whole 3 months, okay? So I had to get it taken out because I thought I'm just gonna keep bleeding. So I got it taken out and I got put back on the progesterone only pill. Prior to the implant as well, the progesterone only pill that I was on was called Yasmin, and I didn't have a great time on it. I think it's Zoella tweeted about this ages ago, and she said, like, does anyone else suffer with their mental health on this pill? And it's really shit because I really like the name Yasmin, but whenever I think of it I just think of this shitty pill. So basically, yeah, mental health was not great. I was taking this pill while I was mentally ill with anorexia. Obviously with any mental illness there's a combination of things that can result in the mental illness. So a lot of things are happening, but I also think the pill contributed quite a bit to it, just because it changes the hormones in you. It can change you as a person so much, and yeah, I wasn't having a great time on that pill, so I would just watch out for that pill. I know Regividon also isn't great. I think that's mentally and like with blood clots and stuff. So yeah, those are the two pills that I would just watch out for, Yasmin and Regividon. I know someone who's on Regividon, and she'd never experienced anxiety before, and now she literally really struggles to go anywhere on her own. She suffers quite a lot with anxiety, and it's ever since she started the pill, so we can see like a little correlation there. So I would just beware, like if you are going on a pill, the progesterone only pill, just remember those two, Regividon and Yasmin. People that I know and myself haven't had a great time on them, so that's just coming from experience, okay? Some people might be having a fabulous time on them, okay? An absolutely amazing time. But from my own experiences, not great. So I would just be wary of those. So had the implant, got it taken out, got put back on the progesterone only pill, but I wasn't put back on Yasmin, I was put on Noriday. So Noriday is quite an old-fashioned pill. Not many people, there's not many people that take it now, but it's the exact same as Yasmin. You take it continuously for the whole time, you don't have a break, it stops your periods. I thought it would. Stops your periods, and yeah, it's a single hormone. Whenever I stress myself out, it would be taken out on my body. I don't really show when I'm stressed, but I would be able to show it internally and like through my skin. So whenever I was stressed, I would set off a period. I would be bleeding, not just spotting, like I would just bleed. I don't think I had the pain as a period, but I would just bleed, my body would just bleed. I know other people suffer from this as well, so maybe it's not because I was ill, I don't know. I don't know if my body's quite weak from it, I don't know. But when I get stressed, I would set up a period on this pill. When exams came, period. I was having a stressful time in a job, period. Like it wasn't great, and I had a boyfriend at the time, and it just wasn't fun because I was either bleeding or I was about to bleed, or it just wasn't great. So I got taken off of Noriday and put onto a combined pill. That fucks me up, so I got put back onto Noriday, and I just had to suck up the bleeding thing. Like I just had to like try and like calm myself and like sort myself out internally. So yeah, I've been on Noriday ever since I was on the combined pill for like a month, I think it was, and it wasn't great for me. So I've been on Noriday for quite a long time, ever since the coil, which was the implant, which was first year. So I've been on Noriday for 2 more years after the implant. So I have recently stopped taking Noriday. I haven't taken it for about 2 months. That is because Noriday and any other progesterone only pill isn't great for your skin, okay? I don't know why I wasn't told this, but my dermatologists have told me, and some other doctors have told me now. But the progesterone only pill is not great for your skin, okay? So I had to come off of it and be put onto another pill, or another contraception, another version of contraception. So I was off of it for about 2 months, and now I have recently had a different type of contraception put inside of me. So coming off this Noriday, the progesterone only pill, my skin has had the ultimate glow up, okay? If you're on a progesterone only pill and you're suffering with your skin, try and get off of it and go on to a different type of contraceptive, because honestly, it's done wonders for my skin. So the pill and the progesterone only pill, the combined pill, the implant, that all gets put into your bloodstream. So the hormone is released into your bloodstream, which then goes all over your body, stopping your periods, affecting your mood, hormones, skin, all of that, okay? And what I needed to have done is have something that was not being put in my bloodstream, if that makes sense. And that is when I decided to get the coil. Yay! So what the coil is, I'll put a little diagram of it inserted so you can see the shape of it and how big it actually is. So it's like a little T-shaped thing. And it's put directly into your womb. So basically the hormone is released. If you get the hormone, there's basically 2 coils, but if you get the hormone coil, that is released into the local area rather than going into your bloodstream and like all around your body and stuff. It's just released in the local area of your womb. So you can get 2 coils. You can get the hormone one, which is generally called Mirena, and then you can get the copper one. So copper is toxic to sperm, and that is how it's used as a contraception, whereas the other one has the hormone, and that is the contraception, the hormone. So I basically was not on any contraception for about 2 months, which was fine. I probably should have come off my pill earlier anyway, because I mean, lockdown, and I could basically qualify as a nun. Is that really bad? So yeah, I didn't need to be on any contraception. I thought it was just like regulating my periods, stopping my periods. I thought, I don't know, I was a little bit wary to come off of it just because I've been on it for so long. I didn't know how I was going to be, if that makes sense. But I came off it for about 2 months and then had the coil put in. So I've had the coil for nearly 2 weeks now, and the whole process of it, I was really quite nervous. So I know people that have had it and they've told me their experiences of it being horrific. The insertion and everything, like the first few weeks of having it, and then after that they say it's like the best decision they've ever made. And I know older people who have had it and they say like, oh, they're just being dramatic, like it's absolutely fine. I got the hormone coil, so I got Marina. There was basically 2 different types of hormone coil. I think there's probably more, but there was Marina and then like a thinner version, in case Marina, like my body didn't like Marina. I think the thinner version is called Jadel or Jades. Jades, I think it's called. So yeah, I wanted the hormone one. I think, well, I've heard that the copper coil is more common in older women who have already had kids, whereas the hormone one is kind of like my age range. But I was informed by the doctor that that's probably just like someone saying that, like it's fine, you can have the copper one if you want. So the Marina one, I'm just going to talk on the hormone coil basis. So Marina lasts for 5 years and the thinner version, Jades, lasts for 3 years, so you get it taken out after that. I am going to go into a little bit of, not detail, but I'm going to explain the whole process of it. So if you don't want to watch this bit, then just skip along a little bit. I'm not going to show anything, I'm just going to speak. So basically what it is you get, I had like an anaesthetic, like a local anaesthetic, just because of the pain, and that already set off the cramps. So you literally feel like you are having the worst period. It reminded me of my periods when I was younger. The worst periods ever, like it was horrible, but you're laid flat and like people are doing stuff, so you can't like crunch up and like help like the pain. You can't do it, you just have to lay flat. So even when the anaesthetic went in, it was really quite painful. And what they did is they had to like just check around and then like open you up. It was no like surgical or anything, they just did it straight from the gene. So they put Marina in and my body wasn't a fan of her. It got pushed straight back out, which was really not fun. So that was fucking painful, okay? It goes through, so you have like the vagina and then the uterus at the top, and then the uterus is like really small, and that is then like, that goes into the womb. So the coil has to go through the uterus into the womb and then like open up, and my body was like, no, close the coil, and came out. So that wasn't fun. So then they tried to put the thinner one in and that was fine, but the pain was insane. I literally had to lie there and I was like, I feel like I'm gonna pass out, like I feel like I'm gonna be sick. It was horrible. I thought I was being really over dramatic, but I was just saying everything that I felt at that time. I was literally like, oh my god, I hate this, blah, blah, blah. And eventually I went home and I had to call in sick for work. I was so ill. I threw up, I slept for so long, and she said like, she gave me a pad because she was like, you might get a little bit of spotting, and I was fine like after the insertion, so I was like, oh, we'll be okay. Had a nap and then got up to go to the toilet, which I was really scared to do because I didn't want to like wee it out, but went to the toilet and there was blood all down my legs and all in the basin, which wasn't great. And I thought, I just kept thinking like, oh my god, this is gonna be it for the whole time. Like it just reminded me of the implant. So cleaned myself up, obviously, went back to bed. I was still in immense pain. What I was doing is taking painkillers and having a hot water bottle. The hot water bottle really helped quite a lot. But I did have to, obviously, like I literally couldn't do anything that day, and the second day I did have work as well, and I went in and it was like fine. Like I was hunched over quite a bit though, but I couldn't work out for about a week, and the thought of doing like core even now, like it still hurts a bit, and it's been like nearly 2 weeks. But yeah, I couldn't work out for a while, and that is the reason why I haven't posted any workout videos, because I haven't been able to get any content. I have got some pre-filmed, but I'm not really feeling myself in it, so I haven't put them out. But I haven't been able to get any new content, which is why I've had to like just pause the workout videos for a bit. But ever since getting the coil, so speaking now, which is nearly 2 weeks since, it is absolutely fine. I haven't had, obviously, any like sexual interaction, so I don't know how it would perform, because apparently the male can feel the threads, because basically there's like some threads that are left out, so that when you need it changing you can pull it out. I'm so sorry, it's very ooh. So yeah, apparently the male can feel the threads. Obviously I don't know if a male can, because I haven't been tried and tested, but they had to leave the threads out, and like after a week the threads kind of like go around the uterus, so they're not like hanging. So like for the week of like the bleeding and stuff, I had to wear a pad. I wasn't allowed to wear a tampon, because that can cling onto the threads, and you can just, yeah, not great. So they should be fine now. They should all be around the uterus, but obviously I haven't had a male test it on me. So I don't know if people can feel it or not, but apparently men can. So that was just like a little run through, a little like description of what I've been through and what I'm having recently. I wanted to talk about the coil because, and I wanted to be as honest as I could. I wish I could show you like some photos, but that's just too far. I'm sorry, I can't do that on here. Just because I wish I knew everything before I got it. I didn't realise, like, obviously your body can reject anything, but I didn't realise that it would actually be pushed out, and the actual pain, the fact that I actually could not do anything that day. I called in, like, I said to work, like, oh, I've got a doctor's appointment, but I should be fine like 4 hours after. Don't do anything for at least the first day, the first 2 days, okay? Just do not do anything. And don't kick yourself about it, because you have just gone through a traumatic thing. You have got this piece of plastic sitting in your womb, okay? So it's a very intense procedure. It's very cringeworthy. It's very invasive, but you've got it for 3 to 5 years. After that, you probably might need to not get another one, unless like you don't want kids. But by the time, like in 3 years, I'll be 24. Maybe I'll have like one more, but you won't probably need it again, so you won't have to go through that again. And once you've gone through it, you've gone through it. I know sometimes it might not work for some people, like the implant didn't work for me. Yeah, I know people who have been on the implant for ages and it's been absolutely fine. So the coil might be like that for some of you, but that was just my personal experience, and so far so good. I mean, it's meant to be a really effective contraceptive, really effective. I think, obviously, I don't know actually, I'm pretty sure it's more effective than the pill. I don't know if that's because it's in the local area or what, but yeah, so far so good. But the first 5 days wasn't fun. I didn't feel great the first 5 days, definitely not the first 2. So definitely just be aware of that. So I put something out on my Instagram saying that I was going to film this video, and I wanted to gather people's experiences that they've had so that I can tell you guys, as well as any questions that anyone had about my experiences or anything else. Obviously I'm not talking from a medical background or as a medical person myself, but I can speak on experiences that I've had and what I know from other people. So someone said, I was on the combined pill for a long time, and I once had a headache and the nurse said that I couldn't take it anymore and put me on the mini pill. So this is like if you get migraines, you need to come off of that pill because it can increase your risk of having a stroke. The mini pill caused me to break out so bad, which I used to be on Roaccutane for. The progesterone in the pill, in the mini pill, isn't great for your skin, like I've said. And it made me really depressed. My final year at uni was not fun at all. I actually ended up in hospital because of my mental health was so bad, and tried to commit suicide. Luckily, I'm still here and went back to a different nurse who reviewed why I was taken off the combined pill, and she says she doesn't believe that I should have been taken off. Interesting. So she put me back on one that really helps my skin. I think the moral of the story is to ask around and don't be afraid to question what they give or recommend you. This might be too much information, but if it can help someone or help start a discussion, I don't mind. that's really brave of her to tell me that. I'm not sure, like, I'm not, obviously it's anonymous, but very happy you're okay. It's shit that you go through so much shit, but the hardest battles are given to the strongest fighters, okay? Okay, the hardest battles are given to the strongest fighters. And it is also crazy how much a hormone can affect your head and yourself. Like, you can change as a person. It is crazy. Us women go through some bullshit, okay? Should we be on it? Are we the ones that really need birth control? But yeah, so progesterone only isn't great for your skin. So I'm glad she was taken off of that. Yeah, they do, like, when you say, like, I've got a headache or I've had a migraine, they will take you off that pill. I'm not sure why someone said that they shouldn't, she doesn't believe that she should have been taken off that pill. Maybe because it wasn't a migraine and it was just a headache. But yeah, she said that she's great. It's really helped her skin, all of that. And just to not be afraid to ask questions or, like, more detail about what they're giving you or what they're recommending, sorry. So always ask questions in anything, in business, in meetings, in life, in doctor's appointments. You're never gonna look stupid because someone else is probably thinking the exact same question but is too afraid to ask it, okay? I always used to think that at uni. I could say some stupid question and people might be like, God, what is she like? God, she didn't know that. But someone else probably has the same question in their head but they're too afraid to say it. That went off on a tangent. But yeah, just always ask questions. You want to know what you're putting into your body. You want to know all the side effects. You want to know all the positives. You want to know about other people's experiences with it. So yeah, really ask people questions. Someone else has said, I got put on the implant in January this year and have had a period since. Same as me. My hormones didn't settle down at all over the 10 months of having it. Oh my God. And I'm going to get the implant removed today because of losing that much blood every day. It's making me really badly iron deficient. I was put on some iron pills at one point because of stressing and then causing a period. But they didn't work with my IBS that I suffered with, so basically my body's fucked. But yes, same experiences as me. I did not stop bleeding on the implant, so it's interesting that someone else is saying that. So just be aware of that. I mean, test and trial the implant if you want, but again, it's quite invasive. It's so much more handy because you're not having to take a pill and remember to take it, and then if you miss it, but myself and this other girl have been bleeding constantly, or had been bleeding while on it, so just be aware of that. Someone else said, I started my pill in May and have been bleeding ever since. It's the third pill I've tried and nothing seems to work. I don't know what else to try. So I'm not sure if this is a combined pill or a single hormone pill, but if it's a single hormone pill, maybe don't try the implant, just because if you're bleeding while on this pill, then I don't know if the implant will help, just because of myself, this other girl that said, and anyone else, like, you could, like, just keep bleeding on the implant. I would recommend the coil. It is invasive. It's not fun to begin with, but I haven't bled since, and I don't seem to be in any more pain. I get the odd, like, period pain, but nothing major. It's just the very first process was horrible, and I was saying to everyone, like, don't ever do it, it's the worst thing I've ever done. But it's getting better, so I'd maybe recommend that. Or the injection. I know someone who's had the injection, she's absolutely fine. I think you get it every 3 months. I think it's every 3 months. You get it, it's just an injection into your bum. It's fine, she's absolutely fine, like, she's not preggers or anything. I don't think her mood's drastically changed, that's okay. So maybe try that. And also there's the patch, but I haven't really heard much about the patch. I don't actually think I know anyone that's on the patch. Okay, and then I've got a few questions. So what have you tried and why did you change from it? That's basically just what I said in the little story time about my journey on contraception. I'm thinking of taking a break from my pill as I've been on it for years. What are your thoughts? I would highly recommend this. It's not a natural thing for your body, so having a break from it would do it wonders, okay? However, someone else said, where is it? Should I stop taking the pill while I can't see my boyfriend because of lockdown? I don't agree with that. So if you want to stop taking your pill, you need to stop taking it for over a month or two. just so it can really get out of your body and you can really get back to yourself. Whereas if you stop taking it for about 3 weeks and then want to introduce it back into your body, it's really going to confuse your body and you're going to be all over the place. So if you want to take a break, which is more than 2 months, or no, more than a month, more than 2 months, but I wouldn't stop taking it just for 3 weeks, because it would have only just got out of your system and then you're going to have to put it back into your system and it's just going to confuse your body a little bit. So I wouldn't recommend having the smallest break. I'd recommend just a longer break. I've been on the mini pill for over 2 years now and I still have the most irregular periods. So if you're on the mini pill, I'm not sure why this girl's on the mini pill, but I would recommend going back on the combined pill, just because that can help regulate your periods, because you will give yourself a break. If not, then maybe try and have a break from the mini pill for like a week and then go back onto it, just to try and give yourself a period. It won't give it long enough to completely get out your system, but your body will realise you haven't taken it. So I would probably recommend that. Again, I'm not a doctor, okay? The doctors watching this might be like, she is speaking some bullshit, but that is just what I think would be okay. But I would talk to your doctor and see what they should say. I've been on and off the pill and feel like it makes me fat and lazy. What are your thoughts? There are some side effects, which are weight gain. However, the main thing that you might be suffering with is the fact that your pill is giving you these glasses that are completely changing your thoughts and everything, and you're seeing yourself through these lenses, and you can like take them off, which is like stopping the pill, if that makes sense. So the pill is like you having glasses and you're seeing yourself through this hormone added brain and eyes and all of that. So that is probably why you're thinking you're fat. This is something that I need to learn, but that is probably why you're thinking you're fat. However, I find the pill can be quite draining, and that is why you could be seen as lazy, or you could feel lazy. However, it is quite a thing it's a big thing on the female body, so don't knock yourself for that. If you're tired, you're tired. If you're not, you're not, okay? Don't kick yourself, but if you feel like you're feeling lazy, then try and like do something. But if it does make you tired, then just listen to your body and just go to sleep or have a nap. Best contraceptive you've been on? I don't think I can say that. Maybe the coil, because I'm not bleeding, and my skin isn't getting any worse. But the beginning process and the process of installing the coil into my womb was not fun. I can't say the best contraceptive I've been on. I obviously haven't tried this with a partner, so I don't know how it would perform in that sense. So I can't really say the best one I've been on, but the implant made me bleed. The combined pill I can't really go on. The progesterone pill made my skin bad and made me bleed. The implant made me bleed. I'd probably say the coil, even though I really didn't recommend it to anyone during the first week because it was horrible. What contraceptive are you on, and does it work best for you? So I'm on the coil. I'm on J-Death, I think it's called, I can't remember. The thinner version of Marina, the hormone coil. And it seems to be working for me fine. But it's really fucking sore to install, okay? That's yeah. I want to know more about the coil, so watch this video, girl, because I explained it a little bit there. But if you do want to know more and you want to get it from an actual medical background, then please go and talk to your doctor, because this is just me talking from experience. The progesterone only pill breaks you out so bad. But yes, I know, okay? It's awful. I'm so glad other people are the same, but so I think some people are okay on it, but if you've got like a history of acne and stuff, Jesus Christ, it breaks you out so bad. So if you're suffering with your skin and you're thinking, shit, I take the progesterone only pill, there you are, sis, there you are. There are a few other questions, but I pretty much touched on everything in the little description, my little story time of my contraception. So thank you for everyone who shared their experiences. I know it's quite hard and it's a very personal topic, so I'm very grateful that people found comfort in me knowing that. And want to talk about it. That's a very, very brave and strong thing, so I'm very grateful for people who have told me their experiences, and thank you for all the questions that I got from people. This is probably a little bit boring, but I hope it can be quite educational. Again, if you have any serious questions or any medical questions, talk to a medical professional. If you want to learn about people's experiences, then this is the perfect video to watch, or you can ask anyone. If you do have any more questions about the coil or any other contraception that I've been on, then just drop me a DM on Instagram. And yeah, I really hope you enjoyed this video. Girl fucking power. Girls are insane. Women are insane. The female body is fucking insane, okay? You need to praise yourself and you need to take care of yourself. So happy Sunday, and I hope you have a good rest of the day and a great week, and I will see you next week. Love you.